Security Administration. The reason you received this phone call from our department is to inform you that there's a legal enforcement action filed on your Social Security number for fraudulent activity. So, when you get this message, kindly press 1 to connect with the next available officer. Thank you.
You reached the law enforcement agency. How can I help you today?
Yeah, I got this message that said there's something wrong with my Social Security.
Yes, sure. Can you help me out with your name so I can pull out your information over you?
Yes, my name is Joe Slow.
And what's your last name, sir?
Slow. It's spelled S in Sierra, L as in Lima, O as in Oscar.
Last name.
Thank you.
Mr. Butler.
My birthday is Christmas Day, 1972. Hello? Hello?
Hi, good morning, this is Robert.
Yes.
Hi. Are you okay?
Oh, when you get to be my age, you're always coughing.
Okay. Well, Mr. Grinnell, I was calling today just to do a brief review. This is Stephanie on a recorded line with Trusted Consumer Advisors. So I was just calling this morning to do a brief review of your Medicare Advantage plan. You are between 65 and 79, is that right?
Yes.
Okay, but I have your birthday gosh, I can't even read. December 7th, 1941. So that makes you 81, doesn't it?
No, someone must have made a mistake. I was born a poor child, Christmas Day, year of our Lord, 1942. When I was born, the battle
Hello?
Hello?
Hello, do you hear me?
Yes.
Sorry, this is Alex with you from U.S. Healthcare Sport. How are you doing today?
I'm okay. How are you?
I'm very good. Thank you, sir. Thank you so much. Sir, the reason of my call to inform you about the Medicare insurance have been dropped down with a huge merger. I'm here to qualify you for the new updated plan. So I believe you have the Medicare Part A and B.
Yes.
That's great, sir. That's very great, sir. What's your age, sir?
I'm 79.
79. Sounds pretty good. God bless you. Sir, you are the one who can take the decision about your health?
Yes.
That's great, sir. Sir, now it's all done from my side. Now I'm going to transfer your call to my manager. They will explain you all new details and benefits which one you can get in the Medicare insurance. Just be online, please.
Yes.
Hello, this is Mike with American Healthcare. How are you doing today?
I'm okay. How are you?
I'm fine, sir. Thank you so much for asking. Well, actually, this call is about your Medicare, and we are providing you more options to see if you can qualify for any extra benefits. Do you have Medicare Part A and B?
Yes. Hello? Hello?
Hello?
Hello?
Yeah, hi. It's Antonio here from Senior Benefits. How are you doing today?
I'm
Doing good?
okay. How are you?
I'm doing as good as you. Thanks for asking. Well, I won't take much of your time. Actually, the reason of my call is to let you know about our new cost final expense insurance plan. And not right now, in a couple of days, our local license agent will give you a call back and provide you all the information like in your free time. So would that be okay if our local license agent will provide you the information in a couple of days in your free
Yes.
time? Okay, so what's the best time to reach you back? Like morning, afternoon, evening?
After 5 p.m. because then I'm finished with playing bingo at the senior center and I'm finished feeding the birds on the park bench.
Okay. In the evening will be okay?
Yes.
Okay, so just for the qualification purpose, may I know how old are you?
I'm 79.
79 years old. Perfect. And God bless you. Take care.
You too. Hello?
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 Good morning, sir. This is Deborah speaking, and I am trying to reach Robert.
Yes, I'm he.
Are you okay, sir?
I'm 79 years old. My bones hurt. My knees hurt. My eyesight is growing dim. But other than that, I'm okay.
I'm sorry about that, sir. I'm so sorry about that, sir. But you see, sir, the reason for my call is to let you know that you might be qualified for the reimbursement on your Medicare Part B premium, as well as other extra benefits. Would this be helpful for you?
Yes.
Okay, so just to verify and make sure you could be qualified for this, do you have Medicare Part A and B?
Yes.
You have the red, blue, white card?
Yes.
Are you still a resident of Michigan?
Yes.
Okay, so are you currently signed up for any health insurance plan?
Just Medicare Part A and Medicare Part B.
Okay, are you over the age of 65?
Yes.
Okay. Sir, I am going to get you over to my assistant who will verify a few pieces of information. After that, they will transfer you to a licensed insurance agent in your state to discuss the new benefits and savings you might be qualified for. Do I have
Okay.
your consent to transfer you to see what new benefits and savings you might be qualified for?
Yes, I want to talk to your licensed secret agent.
What are you talking about, sir?
Well, you said you wanted to connect me to your licensed secret agent.
I am going to get you over to my assistant, sir. Do I have your consent to do that?
Yes.
Give me a minute and I'll get you over to him. Okay?
Okay.
Hello?
Hello?
This is Deborah speaking, and I have with me here Robert. And he is from Michigan, and he's over the age of 65, and currently has Medicare Part A and B, and he's interested in hearing about the new benefits and savings he might be qualified for. Can you assist him from here? Absolutely. Thank you very much, and do have a wonderful conversation. Hello, Mr. Grinnell. How are you doing today?
I'm okay. How are you?
I'm doing good. My name is Danielle Fentress. I'm a licensed Medicare specialist with Premium Choice, talking to you from the great state of Florida. Before I get started, I am required to tell you that this call may be recorded for quality and for training purposes.
Okay.
Also, I'll just share with you exactly what I do for Premium Choice, what these state-approved plans are, kind of the reason for the phone call today, and then you can let me know what you'd like to do from there, okay?
Okay.
All right, so with Premium, well, right now is open enrollment period for all Medicare Advantage plans, and what I do is I help people look at the Medicare Advantage plan that came out for the year 2022 and see if there's anything out there that could be more beneficial or save you some money when it comes to healthcare costs. The cool part about my job is I don't just represent one insurance carrier. I'm contracted with several of the top insurance carriers like Anthem and Humana. Are you still there, Mr. Grinnell?
Yes.
Okay. All right. So different insurance carriers like Anthem, Humana, United, also AARP, Aetna, Cigna, WellCare. So I really can compare and contrast these different plans that are available.
Okay.
So I also help people enroll in the LIS program through Social Security, and that has to do with the reimbursement of the $170.10, either a portion of that or all of that back into your Social Security each month.
That program, LIS, it stands for Low Income Subsidy. It's for people that have Medicare A and B who are on a fixed or low income and have less than $30,000 in the bank as a married couple or $15,000 in the bank as an individual.
Okay.
So those are the things that I do for Premium Choice. And before I can get into the plans and potentially get that $170 back into your Social Security check every month, I do have to read this little statement. It's required since these programs are federally regulated. This is called the scope of appointment. And this is me asking you for permission to talk about the details of the plans with you. It talks a little bit about the different plans I represent as an agent, a little bit about Medicare A and B. It also tells you that I am contracted by Medicare plans, not work directly for the federal government, and that agreeing to speak with me on the phone today does not obligate you to enroll in a plan or affect your current enrollment. I'm just prepared to discuss the options that are available in your area.
Okay, yes.
All right, so bear with me real quick as I read the fun part. It says, the Center for Medicare and Medicaid Services requires agents to document the scope of a marketing appointment prior to any meeting to ensure understanding of what will be discussed between the agent, which is me, and the Medicare beneficiary, which is you. All information provided on this call is confidential and should be completed by each person with Medicare prior to the appointment. Medicare health benefits, an independent broker represents various Medicare Advantage plans, prescription drug plans, hospital indemnity plans, and Medicare supplements. Medicare Advantage plans provide all original Medicare Part A and Part B health coverage, and sometimes Part D prescription drug coverage. Medicare supplements are secondary insurance to original Medicare and helps to cover some of your out-of-pocket costs after Medicare pays its share. By agreeing to this appointment, you agree to a meeting with a sales agent to discuss the types of products we just listed. Please note that the person who will discuss the products is contracted by various Medicare plans. They do not work directly for the federal government. This individual may also be paid based on your enrollment into a plan. Agreeing to this appointment does not obligate you to enroll in a plan or affect your current enrollment. The agent will be prepared to discuss the options in your area and will have materials available for you to review. Now, Mr. Grinnell, it is Friday, January 14th, 2022, 11:03 a.m. Do you agree to continue with the appointment?
Yes.
All right. So the first thing that I like to do is pull up your current plan so I can see what the benefits are that it offers. Do you know the name of your current plan?
I just have Medicare Part A and Medicare Part B.
Okay, so no additional insurance, no like Advantage plans or anything like that?
No.
Okay. And do you have a primary care doctor?
Oh, my Dr. Malpractice, died a few years ago, so I don't have anyone right now.
Okay. And do you take any prescription medication?
Well, I haven't been able to legally get Viagra since the death of my doctor, so I buy it from my friends when I play bingo at the senior center.
All right. So right now, I'm just looking at the different plans that are available in your area. Let me see. Do you, by chance, have both Medicare and Medicaid?
No.
No. Okay. And have you heard of the different? Do you know what the Advantage plans are about? Kind of like the details and what they do for you.
Well, vaguely, because of commercials on TV with Joe Namath.
Okay. Um, well, these Advantage plans are kind of awesome in the fact that, one, there's no premium to them, so it doesn't cost you anything extra to actually have this health care plan. And it also works in conjunction with your Medicare Part A and B. Medicare Part A and B do cover some of the medical expenses, but they don't cover all of them. Where the holes are in that Medicare A and B, the Advantage plans kind of pick up the cost of some things. So the monthly premium, I'm looking at one plan. It's with AARP, which is under United Healthcare, and it's a PPO. This plan is rated 5 out of 5 stars for this year. The monthly premium to this plan is $0, like I said, so it's not going to cost you anything extra. There's no medical deductible to this plan. There's no drug deductible to this plan, so for prescription drugs, you don't have a deductible to meet before the insurance actually kicks in, which is fantastic. Your maximum out-of-pocket is $4,900, which is pretty low for these Advantage plans. Also, it does offer you different things. So, like when you go and see a primary care doctor, when you do get them, the copay for the visit is $0, and that is for both in and out of network. So this is a PPO plan, so you can go both in and out of network to see doctors. To go and see a specialist, the copayment would be $35, and that's both in and out of network. All of your preventative is covered, so you don't have to pay a copay to get anything preventative done. So your yearly wellness visits, your yearly physicals, your blood mass measurement screenings, lung cancer screenings, nutrition therapy services, all of that is 100% covered. So there's no co-payments for any of that. And also like your vaccinations, your flu shots, your pneumonia shots, your COVID shots, all of that stuff. If you do get those, are 100% covered. Also, they do give you a benefit of it's called over-the-counter items. They give you $40 every 3 months towards over-the-counter items at the pharmacy. So you can use that for supplements or vitamins or Tylenol, Advil, allergy medicine, eye drops. I've even heard some people use it for toilet paper and paper towels at the pharmacy, so that's kind of cool. You also get dental insurance under this too.
Oh, I can use dental. I could use some plastic chompers. I lost all my teeth from abusing crystal meth.
Okay. Well, you do get all of your preventative services that are 100% covered. So your oral exams, your x-rays, all of that stuff, 100% covered. But they also give you $1,500 towards your comprehensive. So you can use that towards dentures, towards bridges, and getting different work done on your teeth. You also get vision services under here. So your routine eye exam is 100% covered, but they also give you $150 every year towards eyewear. And you also have hearing under this plan as well. I'm not sure if you need that yet, but
I can use some hearing aids, so this way when my wife talks to me, I can shut them off.
Well, you get your routine hearing exam every single year. Co-payment for hearing aids is around $375, and that's you can get 2 hearing aids every year, 1 per ear. Let me see the other. Just read the other details that these plans do offer. Emergency care, if you do have to go to the hospital hospital, heaven forbid, the copayment is just $90, but that copayment is waived if you do end up getting admitted to the hospital. You also have worldwide coverage under this plan, so no matter where you are covered under your insurance.
Okay.
And they do give you a few additional benefits as well. You get a fitness benefit, which is called Silver Sneakers. They'll pay a certain amount of your gym membership, or if you would rather do your fitness at home, they'll send you like a Fitbit or a Garmin so you can track your heart rate and monitor your steps and all that stuff. You also get a meal benefit under here. If for some reason, heaven forbid, you're not able to provide meals for yourself, they'll make sure that meals still are catered for.
Oh, I can really use some Meals on Wheels.
Also, let's see. If you do end up having to go to urgent care, heaven forbid, the co-payment for that is $40, and then you also have worldwide coverage for urgent care as well. And then you also have, so one big thing to look at for insurance too is inpatient hospital care. I talked to you about if you have to go to the emergency room, there's a $90 copay. But if you get admitted to the hospital, that $90 copay is waived. But then they start the inpatient hospital services, or acute hospital services, they also call it. So most insurances will charge you per day for days like 1 through 5 or 1 through 7. And they'll charge you a copay every single day that you're in the hospital. But after that day 7 or after that day 5, you're 100% covered. So the co-payment for this plan is $325 per day for days 1 through 6, and then days 7 through 90, you're 100% covered under your insurance.
Okay.
And you also have like podiatry services under here. You get 6 visits every year, and that's $35 per visit. If you need to go see the foot doctor. You also have outpatient surgery. That's another one that I saw that was a little bit lower than some of the different ones in your area. It's anywhere from $0 to $275. We usually see it around $350, so that is quite a bit lower than what I see for other plans in your area.
Okay.
You also have chiropractic services under here. So there's no limit to how many times you can go to the chiropractor every year, but it's just $20 to see the chiropractor. If you do have to take an ambulance, there's a co-payment for that too, which is $250, and the other plans I'm seeing around $280 to $350, which is awesome too because it's a little bit lower than the plans in your area. And like I said, also it's rated 5 out of 5 stars. This plan again is called AARP, Medicare Advantage Open, and it's the first plan that they have, and it's a PPO. So what differences between PPOs and HMOs?
I think HMO is I have to go to the I have to drive to the boonies to see a doctor, and a PPO is I can go locally without having to go to AAA to buy a bunch of maps to figure out how to drive to the boonies to see an HMO.
Yeah, well, with HMOs, they're pretty strict about the doctors that you can see, so you have to go see doctors that are in the network. If you go and see a doctor that's outside of the network, then you have to pretty much pay full cost out of pocket for it. With PPOs, you can go in network, and out of network, and you're still covered. And the cool thing about this plan is that the co-payments are the same whether you go see a PPO or an HMO. Whether you go see, whether you're in network or out of network. A lot of times, the prices will be a lot higher, especially for going to see the doctor or a specialist if you go out of network with a PPO. But with this specific plan, they give you will know exactly what you're going to pay. So in and out of network to see the doctor is $0. In and out of network to see a specialist is $35. So you know exactly what you're going to pay, and you won't have to pay a higher co-payment out of network if you decide that that's where you want to go. So you have a lot more flexibility to choose your doctor and who you want to see.
Okay. What do I have to do to join this?
I can start filling out the enrollment form for you right now, and the coverage for you would actually begin on February 1st of this year.
Okay.
Okay. Do you have your Medicare red, white, and blue card?
It's upstairs. It'll take a few moments to get there. You move a bit slow when you're 79.
Okay, no problem.
Bleh, bleh. Excuse me, that happens every time I mix beer and wine. Just another set of stairs. Let me look in the drawer. Okay, let me get on my reading glasses. Your vision starts to go when you're my age. At least when I look in the mirror, I can't see how ugly I am. The number here is 1, E as in echo, G as in golf, 4, T as in tango, E as in echo, 5, M as in Mike, K as in kilo, 7, 2.
Okay. Keep it back. All right, I'm just going to confirm the number that I have for you. I have 1, E as in Edward, G as in George, 4, T as in Tom, E as in Edward, 5, M as in Mary, K as in kite, 7, 2.
Yes.
Okay. Let's see. Is your date of birth 12/7/1941?
No. I was born a poor child, Christmas Day, year of our Lord, 1942. When I was born, the Battle of Stalingrad was still raging in Russia, and it was Franklin Roosevelt's third term in office.
I know, look it up a different way because I think I had a number incorrect on there. Alright, so I am having some difficulty finding your
Oh, I don't know what's going on there.
Hello?
Hello?
Hi, this is Sarah Lawson from the Department of Visa and MasterCard. How are you doing today?
I'm okay. How are you?
I'm good. Thanks for asking. I'm calling you from the Debt Elimination Department of Visa and MasterCard. The reason for this call is to notify you that you've been approved for the Debt Elimination Program for your entire credit card debt under the Fair Credit Reporting Act of 2009. Would you like me to provide you with more information about the program?
Yes.
Hold on. I'm
I'm going to transfer this call to a qualified debt specialist, and they will provide you some more information about the program.
Okay.
Thank you so much for responding, Card Member Services. My name is Michael. How are you?
I'm okay. How are you? And I heard you wanted to pay off my credit card debt? Hello? Hello?
Hi, good afternoon. How are you?
I'm okay. How are you?
God bless you. I'm also fine. This is Jimmy calling from US Health Center. This call is about your Medicare. So I believe you have Medicare Part A and B, right?
Yes.
That's perfect, sir. Can you please tell me what's your age?
I'm 79.
You are 79. Okay, sir. Just stay on the line. I will transfer this call to my senior one. He will guide you with a few-minute conversation. Okay, sir?
Okay.
Okay, thank you. Thank you so much for holding, dear. You just spoke one of my associates regarding your Medicare, and I believe you are 79 years old, right?
Yes.
Okay, in order to qualify you, what's your first and your last name, please?
My first name is Robert, and my last name is Grinnell.
Okay, and by the way, sir, how's your day going so far? So far, so good?
It's okay. Just when it's cold outside, my bones hurt.
Okay, so can you please confirm your 5-digit zip code where you're still residing?
48126.
Sorry?
48126.
48126.
Yes.
And what's your state name, sir?
I'm in Michigan.
In Terrebonne, Michigan, right?
Yes.
Okay, that's fine. So this information I needed from your side, Mr. Robert, okay? So let me transfer your call to one of my licensed agents here with me on the line, okay? She will give you the information regarding your Medicare benefits, okay? When you talk to her, okay? When you talk to her, you need to mention her, okay? You are interested to looking for the additional benefits on your Medicare, okay?
Okay.
So be with me on the line, ma'am. Let me connect your call to the licensed agent, sir, okay? Stay on the line for me, sir.
Your call is very important to us. Please stay on the line. You'll be transferred to the next available agent.
Hello, this is Jalea from the Medicare Health Center, following up on your recent inquiry on how you can save on your Medicare. How are you?
I'm okay. How are you?
Okay, great. And I am okay too. Thank you for asking. So there have been recent changes with plans and rates in your area. During this open enrollment, you may be able to get lower rates or additional coverage. You can also save $50 to $100 on your plan. What I do is I get a licensed agent on the line to go over the possible lower rate and additional coverage with you and check if you qualify for plans that will help with co-pays and deductibles that are not covered by Medicare. So I have a couple questions to ask. Is that okay?
Yes.
Okay. Do you have an advantage or a supplement plan?
I just have Part A and Part B.
Okay, thank you. And when you go to the doctors, do you go to one specific doctor or any doctor?
Well, I normally go to any doctor.
Okay, thank you. And
Can you please provide me with your zip code?
48126.
Thank you. And you are over the age of 65, correct?
Yes.
Thank you. And just to confirm, you're not currently looking for Medicaid?
Hello? Hello?
Hi, my name is Jeff. I'm working with Senior Benefits. What are you doing today?
I'm okay. How are you?
I'm fine, thanks for asking. Actually, the reason of this call is to let you know that the rates on Medicare have recently dropped down up to 35% in your state of Michigan. So I can see on my screen that you do have Medicare Parts A and B, is that right?
Yes.
Wonderful. So, sir, I believe I'm talking to Butler Kesa.
No, my name is Robert Grinnell. That's someone who used to own the phone before me.
So now are you Robert?
Yes, I'm Robert.
Robert, you have Medicare Part A and B, right?
Yes.
Robert, why are you talking so slower?
Because I'm 79 years old, I want to see what you sound like when you're 79.
Oh my God. I would not die, you know.
I want to speak to your supervisor.
I'm laughing because you are talking too slower, sir.
I want to speak to your supervisor.
Okay, sir, sorry about
Hello?
Hello, can you hear me?
Yes, I hear you.
Okay, well, my name is Brian calling you from Health One. How are you?
I'm okay. How are you?
I'm blessed. Thanks for your concern. Well, it is just to inform you, sir, that today you may get entitled to receive a cash back that would be around $148 each and every month on your Part B premium. Isn't that great?
Yes, I can use money back. I need it for my senior housing and my Meals on Wheels and my pills for my reptile dysfunction. So what do I have to do?